And it turns out there are good randomized placebo-controlled trials, that's sort of like the gold standard of science, demonstrating that ADHD symptoms worsen when dyes are in the food. And it's in a dose-dependent manner, meaning the more dye that's in the food, the worse the symptoms are. Hey, welcome to the Eat Your Greens with Dr. Black podcast. I'm glad you're here because if you're taking time out of your day to listen to this podcast, it means that you're the kind of person who is ready to take control of your health. I'm Dr. Black. I'm a board-certified pediatrician. I've been in practice for over 20 years, and I started this podcast to give you the tools you need to live a long, healthy life free from the chronic diseases that are so rampant these days. Welcome back to all of my regular listeners. I want each and every one of you to know how much I appreciate your support. Thanks for tuning in every week for a new episode. And welcome especially to my new listeners. It's great to have you here. I've recently seen people tuning in from places like Washington, D.C., Golden, Colorado, and even Ville Platte, Louisiana. Thanks for joining. I'd like to start this episode with a little informal poll. Raise your hand if someone you know, now it could be you, it could be your child, a neighbor, friend, family member, has ADHD. Or maybe you feel like you probably had it as a kid, but you were never formally diagnosed. I'm willing to bet that a lot of hands went up just now. ADHD is the most common neurodevelopmental disorder, and rates are on the rise. So this is why I think it's really important you are going to want to listen to this episode all the way until the end. The information I'm going to share might just be what you need to help your child, your neighbor, your friend, your family member, or even yourself with ADHD succeed in school, thrive, and learn to get better control of all of your symptoms. I have had several requests to talk about ADHD on the Eat Your Greens podcast. This episode is being released in October. Kids have been back in school for a couple of months. The first report card has come out. And so we're getting lots of questions about ADHD, people wanting their kids to be evaluated in the office at work. So people just like you want to know how they can help their kids other than just putting them on medication. And I'm going to be honest from the start here, right? I am a general pediatrician. I treat ADHD. I do prescribe medications for my patients with ADHD. When the diagnosis is made thoughtfully and appropriately, stimulant medication can be very helpful. In fact, in some cases, it can be life-changing for patients. That's all I'm going to say about that. This is not a pharmacology podcast. You did not come here to learn about medications to treat ADHD. This is a podcast about healthy nutrition, and that's what we're going to talk about today. I spent a lot of time looking at what the science has to say about ADHD and how to treat it outside of medication. I did this so that you don't have to. Do you want to know how your child's diet affects their ADHD? Are you curious about vitamins or supplements and whether or not you should spend the money for them? What about cutting out sugar or gluten from their diet? I think the answers to these questions are going to surprise you, so keep listening. And hey, if you know someone who would benefit from this information, please tell them about the Eat Your Greens podcast. Tell them about the website, www.eatgreenswithdrblack.com. And also, if you have a sec, just go on your podcast app, take a minute to rate the show and leave a review. It's really helpful in growing the show and getting the word out there. I appreciate it. I pretty much always start my episodes with definitions. We need to be on the same page. What are we talking about here? I probably don't need to tell you what ADHD stands for because pretty much everyone has either heard of it or has been directly affected by it. But just in case, ADHD stands for Attention Deficit Hyperactivity Disorder. Now, this is a real disorder. There are people out there who don't believe that it's a real thing. They don't believe that it exists. It definitely does, and it's not even new. There are descriptions going back as far as the late 1700s. So just in case you thought that it was some kind of product of our modern era, that is not the case. There are 3 types of ADHD. There's pure inattentive type. That's where you have difficulty staying focused or maintaining attention. You may make careless mistakes, or you might even avoid tasks that require a lot of focus, which leads to a lot of trouble, say during homework time. People with the inattentive type can't follow complex instructions. They have trouble getting ready for work or school in the morning, or maybe they have trouble completing their chores. And there's a lot of issues with planning and staying organized. I'll tell you, my oldest daughter was diagnosed with ADHD. And I remember during homework time, she was really good at math, but she would make a lot of mistakes because she wouldn't write the numbers in the columns neatly so that they lined up. So she would make just really careless mistakes just because she wasn't really focusing and taking the time to write out the math problems carefully. So those are some examples of the symptoms that you're going to get with the inattentive form of ADHD. The second type is just hyperactivity. So that's where you have the excessive fidgeting or movement, running around, climbing on furniture. Kids with the hyperactive form are at risk for injury. They can be very impulsive. As it happens, Catherine was also hyperactive, and even at a super young age, by the age of 2, she did not have a wind down time in the evening. The later it got in the day, the more active she was until by, as we're approaching bedtime, she's actually doing laps around the couch, just running full out. And I used to say that her bottom was magnetically opposed to the chair. You know how you have 2 magnets? If you try to put the same ends together, you can't ever make them touch? Yeah, that was Catherine and the chair. So you might have guessed what the third type is based on my description of my daughter, and that's combined. So there's just inattentive, there's just hyperactive, and then there's the combined type. With the hyperactive type, actually, I had a patient once who just had the hyperactive type. They didn't have any trouble focusing as long as they could keep moving their body. If the teacher would let them go to the back of the room and just do handstands or something, they were able to pay attention and follow along just fine. Let's talk about a few statistics. Now, the reports that I came across on the internet varied widely. According to the latest data on the Centers for Disease Control and Prevention website, approximately 7 million children in the U.S. currently are diagnosed with ADHD. The numbers ranged from as low as 3 million to the 7 million number. And that represents between 7 and 11% of U.S. children. And the numbers are higher in the U.S. In other countries, something along the lines of 5 to 7% of children are reported to be diagnosed with ADHD. Boys are diagnosed more often than girls, and people who are Black or non-Hispanic whites tend to be diagnosed more often than Hispanic or Asian children. The rates of ADHD diagnosis have risen quite a bit in recent years. Partly this is due to actual rising incidence, but it's also in part due to changes in the diagnostic criteria. Previously, the inattentive form wasn't really recognized, and so now we understand that some people have purely inattentive ADHD. And then also they changed the rules regarding an autism diagnosis. So it used to be that you had to have one or the other, and now the diagnostic manual allows both. So if you have a kid with autism, they can also be diagnosed with ADHD. So what about the causes of ADHD? Of course, the quick answer is mostly we don't know. It's very complex. Lots of things can contribute to the development of ADHD. That includes things like genetics or changes in the expression of certain brain chemicals, things like brain-derived neurotropic factor and modulators of dopamine expression. Causes can be environmental, rising rates of pollution, and social determinants of health, things like food insecurity, also premature birth, or exposure to things like tobacco, alcohol, and drugs as a fetus. There are several areas in the brain that may just be slow to mature or have an abnormal function causing ADHD. In particular, in the frontal lobe, there's something called the prefrontal cortex. And that really needs to have developed normally in order to have the right chemical signals and neuromodulators, neurotransmitters to function properly. So the prefrontal cortex's main job is to regulate attention and focus, as well as things like behavior and emotion. And the right side in particular is specialized for behavioral inhibition, so suppressing those hyperactive behaviors and impulses. We diagnose ADHD just based on the symptoms. There are no blood tests or imaging tests that we can use to help make the diagnosis. So a very thorough history asking about how the child reacts to different situations in different locations, both at school, at home, maybe on outings, maybe at the place of worship, from different people, getting the teacher's report, the parents' report, other family members, looking at the family history. All of these things are taken into consideration when we make a diagnosis of ADHD. But unfortunately, like I said, there's not just like a blood test we can do. And proper diagnosis is really important for a number of reasons. I mean, to begin with, just the ability to learn and succeed in school. I mean, if you're somebody who's really struggling to pay attention, to stay focused, or is constantly getting in trouble for getting up out of the seat or talking, those children internalize those messages and they develop poor self-esteem. They may have higher rates of depression and anxiety. Another story that I tell about my daughter, Catherine, is in second grade, the teacher used these little sticks. They were like colored popsicle sticks. And if you did something that was not acceptable, you had to pull a stick. And if you got 1, 2, 3, 4 sticks. By 4 sticks, that's, you're going to the principal's office. And almost every day, Catherine might come home from school and she had to pull 1 or maybe 2 or 3 sticks. And she told me one day, she's like 7 years old, she's in second grade. She told me that she was not able to be good. She tried so hard, she just couldn't do it. And she was deciding that meant that she was a bad kid, even though she was trying so hard. That was when I decided, we needed to do something about it. Another reason to get a good diagnosis and try to help control the symptoms are peer relationships. Kids who are impulsive, they may not be able to respect people's personal space. They tend to be, say bossy or take over or interrupt. And it's really hard for them to develop healthy peer relationships when the other children might not want to play with them because of those issues. And of course, just think about things like getting into college or keeping a job, issues like that. With undiagnosed or untreated ADHD, that's a lot harder. In fact, adults who had untreated ADHD as children have higher rates of things like car accidents, injuries, substance abuse, and even incarceration and drug addiction later in life. So establishing a proper diagnosis is important. Treating it is important. I'm not going to talk a lot about the conventional treatment. Again, you didn't come to this podcast to hear about that. There are stimulant medications. There are also some non-stimulant medications. Behavioral therapy has been shown to be helpful. In fact, the combination of behavior therapy and medication has been shown to work better than either one by itself. Unfortunately, as you may already know, accessing mental health care, behavior therapy, things like that is really a problem. We have a crisis of mental health care in this country, and it's not always feasible for people to be able to access that. Some of the things that families can do, they can come up with good, positive home behavior plans. They can work with the teachers and the educational staff on developing behavior plans, coming up with a homework plan, things like turning off the TV, set a timer so there's shorter periods of work, broken up with breaks. You can break chores up into individual tasks, maybe put up a dry erase board with some pictures or a list of things to do. I did come across a podcast that I thought was very helpful called Hack Your ADHD. They seem to have a lot of tips, and they're short little 15-minute segments, lots of things that people with ADHD or who have children with ADHD can do to help just like stay organized, stay on top of things, help the child focus and stay on task. Other things like psychotherapy, cognitive behavioral therapy, biofeedback, all of these things have been tried, and there is some evidence to support their use. Another reason to have your child tested if you're concerned and make the diagnosis, whether or not you want to start medication, just having that diagnosis from the doctor, you can take that to the school and work with the educational team to develop something called a 504 plan. That's an educational plan where the child gets accommodations, things like fidget toys or wiggle chairs, things that help them move their body in a non-distracting, non-disruptive way. They might get frequent breaks or shorter assignments, or older kids can take their tests in a separate room to reduce distractions. So there are pros and cons to all of these things. Many of these work better at the elementary level. Once a kid gets to, say, middle school or high school, where the demand for being organized is much higher, they have to know their schedule, they have to go from one class to another, they have to keep up with their backpack, their locker, their assignments. Often I find that the accommodations that were done at the elementary school level just kind of stop being as helpful as they used to. And that's when parents start coming to me saying, okay, I think we're ready to talk about medication now. Let's move on. We've defined it. We've talked about its causes. We've talked about the usual conventional treatment modalities. But you came here to learn about the role that diet and nutrition plays in ADHD. So let's get to that. There are two things to consider when it comes to diet: what nutrients are missing that need to be added, and the opposite. What are we getting in our diet that might need to be removed? Now, naturally, there are lots of claims on the internet. There are tons of products on the shelves making claims about their effect in treating ADHD. And it's confusing, right? What's true? What's snake oil? Should you spend your money on supplements? Should you restrict your kid's diet? Let's find out. Let's talk about it. I'm going to start with micronutrients. Micronutrients are the vitamins and minerals. But first, I need to tell you about the difference between correlation and causation, right? So when you do a study, if you find that one thing seems to be associated with a change in another thing, that's a correlation. That does not necessarily mean that the thing you're studying caused the result. You just see that, well, when this goes up, the other thing changes. So the classic example is ice cream sales and shark attacks, right? It has been noted that when ice cream sales go up, also shark attacks go up. Nobody thinks that buying ice cream causes people to get attacked by sharks. It's just that ice cream is often bought during the summer months, and people also go to the beach and the ocean during the summer months. So that's correlation and not causation. So we really have to keep that in mind when we talk about these studies, because that's what you're going to see. You might see somebody claiming that removal of this food item or giving this supplement was, associated with a change in ADHD symptoms, but it's difficult to prove that that was the cause and not just a correlation. So, in studies, people with ADHD have frequently been found to be deficient in some vitamins compared to people without ADHD. So in particular, vitamin D, iron, zinc, and some of the B vitamins and magnesium deficiencies have been thought to contribute to ADHD severity. But they've also noticed that kids with ADHD often have a less healthy diet than other children. In fact, if you listened to my episode about picky eating, you will remember that ADHD was on the list of risk factors for a child being a picky eater. So is it that ADHD kids tend to eat a less healthy diet, and that's why they have lower levels of these micronutrients? Or is the deficiency itself causing the ADHD symptoms? The reports, unfortunately, are conflicting. Some studies will show that supplementation has a beneficial effect on ADHD symptoms and others don't. According to one meta-analysis, now I'll tell you what a meta-analysis is because that's a very sciencey word. A meta-analysis is not a study in and of itself. A meta-analysis is where scientists pull all the studies that have been published on a subject and they look at them and they look at the quality of the study. Did the study answer the question that was being asked? And was the data strong? So according to one meta-analysis, the only supplementation that really had strong enough evidence to support regular use was vitamin D with magnesium. I also want to point out that pretty much all of the studies published are using these vitamins in addition to medication and not instead of. So they're comparing medication alone to medication with vitamin supplementation or versus placebo. One study in particular indicated that young infants with low vitamin D levels early on had higher rates of ADHD later in childhood. Zinc and iron deficiency have also been targeted as potentially leading to worsening ADHD symptoms. Both of these are required for the synthesis of those neurotransmitters I talked about earlier, so it's kind of logical that supplementation might be beneficial. In studies, zinc supplementation was shown to be helpful, but only in people who were already deficient at the start of the study. If they had normal zinc levels, adding extra zinc did not help. And that seems to be the theme with a lot of the studies on supplements. If somebody is found to be deficient to begin with, supplementing may lead to improvement in their symptoms. And the same is true for iron. Iron is definitely important for proper functioning of our brain. Iron is incorporated into our blood cells, and it's what helps the blood cells carry oxygen around. So not only to help our muscles and give us energy, but also for brain development. And children who are severely iron deficient early in life may actually have lower IQs later. So iron is definitely important for brain function. Now, you don't necessarily have to be clinically anemic, have actual low iron in order to benefit from taking an iron supplement. Ferritin is a storage form of iron, and some studies have shown that even with normal iron levels, if the ferritin is low, the storage is low, then iron supplementation may also help those kids. So something to think about. I would say before you go out and buy a bunch of supplements, spend a ton of money, consider asking your doctor to order some blood tests. Check the levels. What's their vitamin D level, their magnesium, zinc, iron? These are relatively easy tests to obtain. So don't spend a bunch of money. Establish whether or not you're actually deficient, and then consider supplementing. Another common supplement you'll see marketed for ADHD is fish oil or other forms of omega-3 fatty acids. So not to go into too much detail, but basically there are different types of fat, right? Some are healthy, some are less healthy. When we talk about fat, we tend to separate it into saturated. Saturated fat is solid at room temperature, or unsaturated. Unsaturated is liquid at room temperature. And this is based on the chemical structure of the actual molecule. And then with unsaturated fat, we further break it down into monounsaturated fat and polyunsaturated fat. So our bodies can make many of these types of fat, but there are a few that we can't make and we have to get it from our diet. And we call those the essential fatty acids, and they're really essential for our health. And the polyunsaturated fats, called omega-3 and omega-6, are two of these essential fatty acids. Omega-6 is found in a variety of seeds and oils, but also in eggs and meat. And it is important for healthy brain development. It's also involved in our skin, bone, and hair growth, and a number of other functions. But too much omega-6 can promote inflammation. Omega-3 is also found in seeds and nuts, oils, things like that, also in fish. And it actually has been shown to reduce inflammation, including neuroinflammation or inflammation in the brain. It's estimated that Americans get 14 to 25 times more omega-6 than omega-3. And that's mostly due to the high intake we have here of high-fat meat and eggs relative to things like fish, nuts, and healthy seeds. So in some studies, they've shown that children with ADHD may have lower levels of the anti-inflammatory omega-3 fatty acid in their blood compared with controls. If you go to your local pharmacy, health food store, grocery store, you're going to see a number of omega-3 supplements, fish oil, things like that on the shelves. It's been widely touted as a treatment for ADHD. Unfortunately, the trials on essential fatty acid supplementation have been disappointing. There has been really little to no benefit found in the studies according to the meta-analysis. I mean, you can go and look and you will find studies that show a benefit, but there are also studies that don't. And when they compared all of those together, the ones that did not support a benefit outweighed the ones that did. So unfortunately, although omega-3s are healthy and we need them, they're anti-inflammatory, an omega-3 supplement may not actually help your child's ADHD symptoms. All right, well, that's the not very clear answer to the question about what can we add to the diet. Maybe some vitamin D and magnesium, but a lot of the other vitamins that are out there that are marketed just don't have lots of good evidence to support their use. So save your money. But what about the opposite? What about things in our diet that we should consider removing? Well, one of the big ones that I hear about a lot, I get asked about a lot, is artificial food colorings or food dyes. Food dyes are a huge industry. In fact, about 15 million pounds of dye is used every year in food, cosmetics, things like that. Several of them have been banned because they have been shown to cause cancer. And one of them has been investigated for its effects on thyroid hormones, but also effects on ADHD symptoms. So if you had asked me a couple years ago about how food dye affects children with ADHD, I would have said I didn't think there was any evidence that artificial coloring had an effect. Now, mind you, even back then, I would have been advocating for a healthy diet with lots of fresh fruits and vegetables and limited processed junk food. And that automatically reduces the amount of artificial coloring in the diet. So I really didn't have any incentive to go and look to see what the evidence was. Now that I've started a podcast and I'm talking about it, and I have shifted the focus of my practice to more of a nutrition focus, I actually looked. And it turns out there are good randomized placebo-controlled trials, that's sort of like the gold standard of science, demonstrating that ADHD symptoms worsen when dyes are in the food. And it's in a dose-dependent manner, meaning the more dye that's in the food, the worse the symptoms are. The evidence about the effects of dyes in foods is strong enough that many of these dyes have been taken out of products in European countries. Unfortunately, that has not really been the case here in the United States. What about gluten? That's the next most common thing that I get asked about or that you see on the internet, social media, things like that. Gluten gets blamed for a lot of things, and ADHD is one of them. And it kind of makes sense because people with celiac disease, celiac is, an autoimmune disease. It's an allergy to the gluten found in things like wheat and other grains. Patients with celiac are known to have brain fog. They have difficulty focusing if they eat foods containing gluten. So it follows that even people without celiac disease may have worsening attention with high levels of gluten in the diet. And so several studies have been done looking at whether children with ADHD have higher rates of celiac. Also the opposite, children with celiac, do they have higher rates of ADHD? And unfortunately, no correlation was found. But I would like to say that pretty much all of the studies that I came across were specifically looking at celiac. There is something called non-celiac gluten sensitivity. It's less well defined. There's not a blood test to diagnose it. And I did not see any studies looking at children who have ADHD but do not have celiac and whether or not gluten affects ADHD symptoms. So they may be out there. I just didn't come across any. I didn't find any meta-analysis of this. All the studies that I came across were specifically looking at celiac. So we don't know. And you can go back to if you want to learn more about celiac and non-celiac gluten sensitivity, you can go back and listen to my episode on food allergies. I talk a bit more about that. But the bottom line is we really just don't know yet. And some people feel like they feel better and they focus better when they remove gluten from their diet. And that's fine. What about other types of elimination diets? An elimination diet is where either a single food or multiple foods are completely eliminated, and then the ADHD symptoms are monitored. If there's an improvement in the symptoms, then you reintroduce those foods gradually, one at a time, to try to determine which one might actually be triggering the symptoms. And this elimination diets have garnered a lot of attention with regards to ADHD. There are a bunch of studies out there. They are widely promoted by a lot of people who are wanting to sell their particular form of the diet and make money, or people who claim they can test your hair or something like that and tell you what you're sensitive to and you should eliminate broad categories of food. The problem with these is that elimination diets can really affect the quality of life, especially for a child. Imagine having to go to school, your friends are eating different things, you're going to birthday parties, and you can't eat any of that stuff. It can affect the family's quality of life, their ability to go out to restaurants, go to family gatherings, things like that. With the elimination and then the reintroduction can take a lot of time. They're arduous. They really have to be done under the supervision of a trained physician or dietitian. So they're not easy. They're fraught with problems. And unfortunately, when they looked at these diets and the evidence of whether or not they helped, the evidence was not very strong for the most part that these elimination diets actually benefited the children. Some benefited, but others did not. And considering all of the problems, the potential for nutritional deficiencies, things like that, it's really not something that parents should just jump into without a lot of consideration, thought, and doing it in a proper manner. So you'd really have to do it with somebody who knows what they're doing. So just use caution. Now, you're probably wondering why I haven't talked about the most common ingredient that gets blamed for hyperactivity and impulsive behavior. Can you guess what I'm talking about? Sugar. I haven't talked about sugar yet. Duh. Ask any school teacher who's had to teach kids the day after Halloween, and they'll tell you too much sugar absolutely makes kids hyper. And there is some science to support this. For example, one study showed a 40% increase in ADHD symptoms in kids who drank a lot of sweetened beverages, things like soda. Now, on the other hand, just like I said before, there are also studies that failed to show a difference when kids were given higher amounts of refined sugar. So some kids go crazy with refined sugar, others not so much. Keep in mind, though, we don't eat foods in isolation. Our diet is a mix of components. And when you add in one thing, you're often replacing another. So, for example, there was one study that showed improved ADHD symptoms in people who had higher intakes of milk, of dairy. The question is that because there was a protective effect of the dairy itself, or is it because they were drinking milk instead of soda? So was it the dairy or the lack of sugar? Which one is worsening the symptoms? So I wonder if you're getting a little frustrated by now. I promised at the start of the episode that I would give you some science-backed advice on things that you can do outside of medication to help your child, or maybe even you, with ADHD. And so far, we've learned that with the exception of artificial food coloring and sugar, which you probably already knew about, the science is pretty weak regarding just about every vitamin or dietary element I've discussed. So, what can you do? What's the secret? As it turns out, reducing our diets down to their individual components may be the wrong way to think about it. Like I already said, we don't eat foods in isolation. Nobody's just eating gluten or just eating sugar. We need to take a step back and we need to consider the bigger picture, not just fish oil, but the overall diet. What are you eating most of the time? There is an impressive amount of evidence comparing a number of healthful, plant-predominant, plant-forward diets with the standard Western processed food heavy diet. So there are several meta-analyses. Remember, these are published studies that compare data across individual studies to analyze the strength of the evidence. And there are several out there showing that ADHD symptoms consistently worsen when the diet is high in processed snacks, sweets, and junk food. And conversely, the ADHD symptoms consistently improve on diets rich in whole, minimally processed vegetables, fruits, and whole grains. Some of the specific diets studied include the Mediterranean diet, the dietary approaches to stop hypertension or DASH diet, and a vegetarian diet. One of these reviews comparing various patterns of eating concluded, and I'm going to paraphrase here, but they concluded that a healthy dietary pattern with consumption of fruits and vegetables, fish, and high in polyunsaturated fatty acids and micronutrients, such as magnesium, zinc, and phytochemicals, decreased the risk of ADHD by 37%, whereas the Western diet pattern, which is rich in red and processed meats, refined cereal grains, or like refined flour, soft drinks, and hydrogenated fats, was shown to increase the risk of ADHD by, get this, 92%. And then a third pattern that they described, which was the junk food pattern, that was characterized by a high intake of processed foods with high amounts of artificial food coloring and sugar, was found to increase the risk by 51%. So, healthy, whole food, plant-predominant diet reduced the risk by 37%, and the other diets rich in sugar, processed food, processed meat, high fat went up as high as 92%. That's incredible. That just blows my mind. Why is this, though? I mean, obviously, there's just like, it's a healthier diet, and if you're not sick, you're going to be able to focus better, think better. But, scientists, we want to sort of drill down and try to figure out what exactly could it be about these healthier diets that could result in an improvement in ADHD. So one of the proposed mechanisms is a reduction in oxidative stress. So, as a part of metabolism, our body generates these things called reactive oxygen species. They're chemicals that go out there and cause a lot of inflammation. Diets that are high in things like berries, green leafy vegetables, and seeds like chia, flax, walnuts, things like that, and also fish. These are all sources of antioxidants. So antioxidants are the chemicals that go out and combat those reactive oxygen species and fight oxidative stress. So there's growing evidence that a healthy, whole plant-based diet can do lots of things for our brain health. We're talking about things like slowing the progression of Alzheimer's, improving long-term memory, cognition, and also ADHD. Now, let's not forget the effect that the diet has on our gut microbiome and the role that it plays in the gut-brain axis. I did a whole hour-long episode on the microbiome. I interviewed a professor from Texas State University. It was really fun and informative, very science-y, I'll admit, episode. So go back and listen to that. But basically, all of these bacteria that live in our gut, that's called the gut microbiome. They are really important in our overall health, but also in our brain health. So there's something called the gut-brain axis, where our bacteria in our gut essentially talk to our brain. And remember back at the start of the episode when I mentioned those neurotransmitters, norepinephrine and dopamine, and how they're thought to be important in generating ADHD? So these neurotransmitters are mostly produced in the gut. They're not made in the brain. They're made in the gut, and our gut bacteria play an important role in their synthesis. And you need healthy strains of gut bacteria. The strains of bacteria that we get when we eat a processed diet or a diet high in red meat and processed meat, actually those bacteria are pro-inflammatory. They release chemicals that go out and cause lots of inflammation. But when we feed our bacteria healthy, high-fiber, plant-based foods, we get a much more healthy, diverse population of those gut bacteria. And they make chemicals called short-chain fatty acids. They are amazing. They go out and do so many things in the body, and they can cross into the brain and help reduce inflammation. Taking care of our gut bacteria is important. Well, what about probiotics? Probiotic is a supplement. It's basically those healthy bacteria, those beneficial bacteria. You can take it as a supplement. That's called a probiotic. And there are studies that have demonstrated improved ADHD symptoms with probiotic supplementation versus placebo. One study gave probiotics to pregnant moms starting about 4 weeks before they were due to deliver, and then extending for the first 6 months of the infant's life. And what they found was that this led to reduced rates of both ADHD and autism in the child later on. But this evidence is really still emerging. A lot more of research needs to be done. But the more we learn, the more we understand how crucial those gut bacteria are. And that's why I talk about it on almost every episode. I am going to talk about how you need to feed your turtle. So what do I mean by that? If you've listened to other episodes, you already know. Pretend you have a turtle that lives in your tummy. And that turtle is your gut microbiome, your gut bacteria. Turtles like to eat things like green leafy vegetables and fruits. And that happens to be what our gut bacteria like as well. High fiber foods that are rich in all these things like polyphenols and isoflavones. All these things support those healthy bacteria. So you can spend tons of money on probiotic supplements, but you are basically wasting your money if you're not feeding and supporting them. So feed your turtle all those healthy foods. Your turtle will take care of you. Before we wrap up, I do want to talk about a few other non-dietary lifestyle factors that you can do to help ADHD symptoms. And number one is going to be adequate sleep. We need about 7 to 9 hours of quality sleep every night. And so to help your child or even yourself get that sleep, turn off the devices at least an hour, maybe 2 hours before bedtime. Have a nice, calming, low-stim bedtime routine. Sleep in a cool, dark, and quiet room. And in the morning, go outside. Get morning sunlight. Even 10 to 15 minutes of sun exposure in the morning helps to set our circadian rhythm. It tells our brain when it's morning, and then our brain says, okay, 12 hours later, now it's time to go to bed. So all of these things can help you get adequate sleep. You could even consider an hour or so before bedtime having a little snack with some tart cherry juice and pistachios. And these are foods that help to boost our natural melatonin production. Melatonin is something our brain makes that helps tell us it's time to go to sleep. So you might consider that. If your child snores loudly, whether or not they actually have apnea, talk to their doctor. If they have allergies, get those under control so that they can breathe comfortably at night without mouth breathing. There is something called sleep disordered breathing, and so that's basically where your sleep is disrupted because you're not breathing properly, and that can cause ADHD-like symptoms during the day, basically due to chronic sleep deprivation. So be aware of that. Talk to your doctor. The second lifestyle factor that has been shown to be helpful for ADHD is exercise. So when we exercise, not only are we increasing blood flow to our muscles, but also to the brain. And so that's beneficial. Expecting kids, or really even adults for that matter, to sit at a desk all day without the opportunity to get up and move their body is a recipe for poor health, both physical and mental. Everyone can focus better if they're given regular opportunities to stand up, walk around, move. Another reason that I think ADHD symptoms might get worse in middle school and high school is that they don't have recess. I mean, maybe they're doing athletics or pre-athletics, but not every kid is going to do that. And so the opportunities for physical activity and exercise drop dramatically in middle and high school. So make sure your kid is getting plenty of regular exercise. That's why your smartwatch comes with one of those reminders to stand, right? If you're sitting at your desk all day, it's not healthy. So be sure to at least, at the very minimum, stand up for a few minutes every hour. Well, I'm so glad you joined in to listen to today's episode. I hope I've cleared up some of the confusion about the complexities of treating ADHD. I mean, the takeaway message here is it is complex, and the treatment needs to be individualized to the specific patient. No one medication or one supplement or even one dietary pattern is going to help everyone. Consider asking your doctor to order tests to look for vitamin deficiencies like vitamin D, zinc, ferritin, and the B vitamins. You could consider a vitamin D or magnesium supplement if your doctor agrees that that's appropriate. But basically, don't waste your money on tons of expensive supplements and vitamins. By and large, it's probably not going to be helpful. So see what I did for you there? I already saved you money right off the bat. Also, be wary of elimination diets. You know, if you really feel strongly that a certain food or food component like gluten is triggering your or your child's symptoms, then work with a trained dietitian or a physician to come up with a thoughtful plan for eliminating and then reintroducing that food to test whether or not it's truly causing the symptoms. We don't want to risk nutrient deficiencies or just diminished quality of life and stress by doing large-scale multi-food elimination diets. And there are plenty of people out there claiming that these are helpful. So just be really cautious if you come across that. You know, it's important to point out every single one of the nutritional recommendations that I discussed today can actually be addressed with a whole food, plant-forward diet. You get lots of antioxidants, iron, zinc, the omegas, less refined sugar or processed carbs, no artificial food dye, right? Apples are red, cherries are red without dye, and fruits and vegetables already come with the prebiotics and the probiotics that are going to lead to improved gut health. So there you have it. The single most important thing that you can do to help yourself or your child with ADHD is, to the extent possible, follow a whole food, plant-forward diet. There you have it. Big surprise, right? I mean, you're listening to the Eat Your Greens with Dr. Black podcast. What did you expect? Thanks again for being part of the Eat Your Greens family. If you found value in the information I presented today, please rate and review it on your podcast app. And most importantly, share it with a friend. Thanks for listening, and don't forget to eat your greens. Please be aware that this podcast provides general health information about nutrition and feeding of infants and children and is meant for educational purposes only. It's not intended to replace the important relationship between a parent, child, and pediatrician. If you have concerns about your child's nutrition, health, or growth, please consult your doctor.